Epilepsy is a state of recurrent seizures. Triggers are individual, but there's some that are universal. The brain does need optimal stagings of sleep, particularly deep sleep. If that is not good quality or not enough quantity, that makes the brain irritable, and if the brain becomes irritable, it's easier to have a seizure. But we do counsel people to be careful in terms of how much alcohol that they drink. For women, 1 equivalent in a 24-hour period, and for men, 2. Once beyond that, for a seizure patient, it can cause more problems. It can interfere with actually achieving the right amount of time in the deeper stages of sleep. That predisposes and makes it easy then for that person to potentially have a seizure then the next day. Some common stimulants that people should avoid in general in excess, but in particular if you have epilepsy, are excessive amounts of caffeine. It can be very disruptive for seizure patients and overstimulate the brain, irritate the brain, and produce seizures. Tell your other doctors that you are on seizure medication. If you do need an antibiotic, there's some common ones that make it easy to have a seizure. There are also common antidepressants are things such as diphenhydramine, some herbal medications such as ginkgo that can make it easier to have a seizure. Flashing lights, music, or certain kinds of beats can also set off seizures in some particular patients. These are what we call reflex epilepsies. When patients are first diagnosed with epilepsy or seizure disorder, it's traumatic, but we tell them the good news is you can lead a very normal life.